Well, my research over time has changed, and actually, I'm approaching being here at NC State for 40 years. I came prior to liquor by the drink and prior to when you could buy a bagel in Raleigh. So I'll tell you a little bit about what I've done over time. I've always been interested in communities and work. So when I first started here actually it was in 1977, I, with some colleagues, did some studies of textile communities, which were undergoing large-scale change. Globalization, automation was reducing the number of workers, and also in some communities there was struggle over unionization. So for example, we did a study of Roanoke Rapids, which back in the 70s had a major employer being the J.P. Stevens Company. Later on, actually in the 90s, I did a study of Kannapolis, where it was Fieldcrest Cannon Mills was the major employer. Now that campus is part of the NC State Research Campus. It's no longer a textile community, it's become a bedroom community for Charlotte. So over time, I've done work in community and particularly looking at the changes in the textile industry. I've also done a major series of projects with colleagues at the UNC Chapel Hill School of Public Health on work, injury, and occupational exposures. What we might call social epidemiology, or what we might call looking at the causes and consequences of occupational hazards and exposures. We've looked at farming communities, but particularly we did a number of studies that examined young workers between 14 to 18, their jobs and what they were exposed to in their work environments. For example, one of the things we found, not surprisingly, is that young women expressed concerns about sexual harassment in their jobs, while young men were often in the back flipping burgers or working in the kitchen, and they expressed concerns about slipping, trips, falls, and burns in their jobs. Currently, I'm working more in the area of obesity, where with a former doctoral student who's now at Research Triangle Institute, we have a large data set on children in North Carolina, and we're looking at what might be some of the social causes of obesity. And with some of my colleagues in this department, Human and Ag Sciences, we have a project from the Centers for Disease Control that's looking at weight among low-income communities, looking at adults and children, and looking at interventions that might be effective in terms of reducing weight. So over time, I've done different projects, and depending on the project, I've also used different methods. I was trained as a very quantitative sociologist in the 1970s. That was all the rage at the time. It was when, in a sense, computers were really being extensively used for data analysis. And when I say computers, I mean what used to be called a mainframe, and where you had to talk to it with a series of punch cards. I know it sounds like it's an episode out of an old science fiction movie or something, compared to what we can do right now with our smartphones and with our linked computers. So I've done surveys. I've done a lot of work with what could be called existing data or public use data sets. That, for example, is census data that we might download from a publicly available website, turn into a machine readable, or in a sense a data set that one can examine either with something like Excel or with some of the statistical programs like SPSS or SAS. We've also done focus groups, particularly when we're beginning a research project. We've done historical research. When we were doing the textile community studies, we spent actually just a lot of time in the libraries reading about these communities and assembling, in a sense, community records on how employment and conditions in the textile mills changed over time. So right now, I guess I would kind of describe my approach as what's called mixed methods, where in a sense it's a combination of quantitative and qualitative depending upon the project and depending upon what your needs are. Um, Methods are good for asking questions, so it's hard to say which ones I prefer. Um, I certainly prefer to get a data set rather than having to collect it myself, because collecting primary data it's expensive, it's time consuming, and no matter how well you plan it, no matter how well you think you've thought it out and pre-tested it, something's going to go wrong. I mean, you just have to expect either it's going to be some anomaly or some sort of part of it that just isn't going as well as you expected it to be. So I guess in terms of the issue of what methods, it's a question of it's an issue of what's your research question. And depending upon your research question, then issues of methods and availability of data should kind of flow from that question. I kind of see the research as kind of being engaged in a huge jigsaw puzzle. You have previous studies which you try to put together to be part of the picture, and you start your own research to try to add more parts to it. And kind of the favorite part of it is perhaps at the end, where you hope you can finally see what the jigsaw puzzle is going to be. You know, it's kind of like having a jigsaw puzzle of Mount Rushmore, and you still don't know if you're dealing with Washington's nose or Teddy Roosevelt's mustache. So the favorite part is kind of the aha, when the pieces begin to fit together and you get a picture of what's going on. Of course, the correlating to that is that sometimes you're frustrated. Despite your best efforts, you still find that there's lots of pieces of the jigsaw puzzle missing. And, you know, your kind of aha moment is at best partial, or saying it's got to be postponed. But again, I see research as not just a set of methods, but as trying to answer some questions about what's going on in social reality, and some questions about what can be done to either change the situation or what are the effects of policy on it. So again, I think the most fun is when at the end, when things begin to come together. You know, when all the pieces of the puzzles that you're working in kind of begin to align, and you can sit back and say, oh, so this is the story that I can tell. This is what's going on. This is what I've learned. Right now, the challenges are kind of, well, for one thing, there's such an explosion of knowledge in all sorts of academic and public health and public policy areas. I think one of the challenges is that it's honestly hard to keep up. I mean, we now have all these great search tools through the library. I mean, you no longer have to actually thumb through a journal to find previous research. You go up into the library, you get into a database. In public health, there's a big database called PubMed, another one called Medline. You put in your search terms, and then you've got 300 hits, and then you can go through the 300 to find the 10 or 15 or 20 that are most relevant to your project. So I think one of the biggest challenges is that it's much easier to obtain information, particularly on previous studies or studies in the journals that you need to read in order to understand, you know, the context or how you want to design your own research. It's much easier to find it, but on the other hand, it can be easily overwhelming, simply because there is a lot of work being done, and you can easily, you know, just get snowed under with, you know, and get intimidated by the amount of work that's out there. So you've got to have a good strategy of managing the information that's out there, because it can be, in a sense, overwhelming. Over time, the technology has also created new changes for survey research. Couple of years, 2 or 3 years ago, we were working on submitting a grant application to replicate a national survey of working teens that we did about 10 years ago. And so this is primary data collection using survey research telephone survey techniques. Well, landlines have become obsolete, right? And people have all these cell phones. So the statistics and the sampling has become much more complicated. In fact, I can't even describe how to do it. I have to go to a sampling expert for help with these sorts of things. So basically, the estimate for doing the survey and doing it in a very rigorous manner was close to $1 million. And that was actually more than what the grant would have paid over time to support the research. So we had to go back and really rethink and redesign it. So again, the technology has really made things easier in some sense, but it also has made some of the survey research, some of the methodological techniques much more complex and therefore much more expensive. There's increased emphasis on doing interdisciplinary, what they call multidisciplinary research, which is important because you get people with different experiences and different perspectives. And that's a positive, but it also means that you have to work harder in getting a team together. And given the way in which people in a university are oftentimes pulled in multiple directions with multiple appointments, sometimes getting the team all in one spot gets to be difficult. The current CDC projects funded by the Centers for Disease Control on, it's called Health Matters, in which we're looking at interventions for obesity in 4 low-income North Carolina counties. We have an excellent team from both human and ag sciences and parks and recreation. But at best, we can try to meet together once a month in person, simply because of the scheduling and the demands that everyone has to deal with. So it's become, in a sense, you have to spend more time and energy and, in a sense, communication and keeping people involved in the project as, in a sense, you attempt to deal with programs and research that tends to be more multidisciplinary. What my advice? Read a lot. I think that's the first thing to think about. Read a lot, read the journals, read critical reviews of the field. Again, don't be intimidated simply because there's a lot of literature in the field. Oftentimes literature tends to replicate and repeat itself, which is very good, but sometimes a bright idea can come from somebody who's beginning a research program and a research project that simply hasn't been thought about before. So you need to read a lot, and you need not to be intimidated by the volume of research in your field of study. And from reading a lot, you can begin to start to ask critical questions. And by asking these critical questions, then how you might design a research program based upon the resources that you have available to you in terms of either time, data sets, faculty, resources at the university, begins to be a puzzle that you can begin to work out. So again, I think the first step in any research is to read books, look at the professional journals in the field, get a sense of what people are doing, and again, don't be intimidated by it. It's in the sense to have a critical eye towards it, and a critical eye means that you can understand the strengths and the weaknesses of the existing work. All research has strengths and weaknesses. I mean, yes, indeed, if I had unlimited time and unlimited money, you might be able to design the perfect research project on childhood obesity. Of course, it may take you 10 years before you think you have enough data to be able to say things, and for most of us, we don't have 10 years of time. So it's, again, I think it's having a critical sense, a critical eye, and learning from what's going on ahead of you, but being able to ask the critical questions, be able to formulate a new set of research questions or a set of research questions that need further investigation.